They dragged her out through the front doors of her own emergency department. Security on both sides, patients watching from gurneys, nobody saying a word. Emily Carter didn't fight them. She didn't cry. She just walked, jaw set, eyes forward, like a woman who'd seen worse. And she had. Then the convoy arrived, 6 armored vehicles, uniformed soldiers, and a special operations commander who stepped out, surveyed the scene, and said 4 words that made the hospital director go pale. "Where is Emily Carter?" Because the woman they just fired? The military had been looking for her for 3 years. If this story already has you on the edge, drop a like, hit follow, and tell me in the comments what city you're watching from. I want to see exactly how far this story travels. Now let's get into it. The morning it fell apart started the way most mornings did at Blackwood Regional Hospital. Badly. The ER at Blackwood Regional had been understaffed since February, when the administration cut 2 nursing positions and redistributed the workload without redistributing the pay. Nobody filed a formal complaint because the last person who did, a floor nurse named Delgado, ended up transferred to night shift processing discharge paperwork until she quit. That was how things worked at Blackwood. You learned the shape of the walls, or you got pushed into them. Emily Carter had been learning the shape of those walls for 6 years. She wasn't the kind of nurse people wrote articles about. She wasn't the one organizing morale events or bringing baked goods to staff meetings. She was the one at Bay 4 at 3 in the morning when a teenager came in seizing, the one who caught the potassium error before it hit a post-cardiac patient's IV line, the one who'd stayed 40 minutes past the end of her shift 11 times in the last month because she couldn't leave a patient mid-assessment. She didn't talk about it, she just did it. The other nurses noticed. The doctors mostly didn't, except when they needed something. Dr. Marcus Holt noticed in the wrong way. Holt was Blackwood's chief of emergency medicine, early 50s, the kind of man who wore his credentials the way other men wore expensive watches. He had good hands and worse people skills, and he'd built his department around a culture of deference so absolute that even the senior attendings hesitated before questioning him. He wasn't technically corrupt. He was something subtler, a man who'd confused authority with correctness for so long the two had fully merged in his mind. He and Emily had been circling a collision for 2 months. It started over a dosage protocol. A patient, a 63-year-old woman named Aura Tatum, admitted for chest pain that turned out to be demand ischemia, had been ordered a medication combination that Emily flagged as contraindicated given her existing renal function. She brought it to the attending. The attending brought it to Holt. Holt reviewed it and said the order stood. Emily documented her concern in the chart. Holt didn't say anything about it directly. But 2 days later, her schedule got rewritten. Less autonomy, more administrative tasks. She was moved off trauma rotation and put on general intake. She didn't complain about that either. What she did do, what got her here, to this specific morning, being escorted toward the front exit, while a security guard named Porto held her elbow like she was a shoplifter, was find something she wasn't supposed to find. It had started 3 weeks ago with a supply discrepancy. A small one. The kind that could have been a data entry mistake. 2 cases of OR-grade hemostatic dressing listed as received but not appearing in the physical inventory. Emily had mentioned it to the supply coordinator, a nervous woman named Bryce, who went quiet in a specific way. Not confused, not annoyed. Quiet like someone who'd already decided not to see something. Emily pulled the records herself. Not because she was looking for trouble, because a hemostatic dressing shortage in a trauma bay could kill someone. What she found was not a data entry mistake. The discrepancies went back 14 months. Medical supplies marked as received, invoiced at full rate to insurance providers, and in some cases to federal reimbursement programs, and physically absent from the inventory. The numbers weren't enormous on any single line, but across 14 months of billing cycles, the total came to something that had exactly 2 possible explanations: sustained clerical failure or sustained fraud. She'd printed the records. She wasn't sure why. Maybe she already suspected, somewhere underneath the rational part of her thinking, that simply reporting it through normal channels would make the paper trail disappear. She kept the printouts in her locker. She sent an email to the hospital's compliance officer, a man named Strike she'd never personally met, marked it urgent, and waited. That was 11 days ago. No response. 7 days ago, she sent a second email. 4 days ago, her access to the supply management system was quietly revoked. It told her it was a system update. She had no official reason to doubt that. 2 days ago, she was called into an administrative review meeting she hadn't been informed about in advance. 3 people in that room: Holt, the hospital's executive director Randall Voss, and an HR representative named Kwan, who spent most of the meeting looking at her shoes. The meeting was nominally about a patient complaint, a family member who'd claimed Emily had been dismissive during a difficult conversation. The complaint was vague enough to be unfalsifiable. Emily asked for the date and patient file. They told her it was still being processed. She asked if this was related to the supply discrepancy emails she'd sent to compliance. Voss said, "That's not what this meeting is about." She looked at him. He held her gaze for exactly 3 seconds and then looked at his folder. That was the moment she knew. This morning, the morning everything detonated, started with a patient named Dale Merritt, 47, brought in by his wife at 7:18 a.m. for what presented as severe abdominal pain. By the time Emily finished intake and got his preliminary labs back, she was looking at a picture that didn't match the intake narrative. His pain was in the right lower quadrant. His white count was elevated. His temperature was borderline. She ordered an ultrasound and told the attending on duty, Dr. Reyes, that she was concerned about appendicitis or possibly a perforated viscus. Reyes agreed and signed off on the imaging order. Then Holt walked through. He looked at the order. He looked at Emily. He said, "Cancel the imaging. Put him on oral rehydration and observe." Emily said, "His presentation is consistent with acute appy. His pain isn't consistent with a GI bug." "I've been practicing medicine for 22 years, Carter." "I'm not questioning that. I'm telling you what the vitals and labs are showing." Oral rehydration and observe. He turned to walk away. "If we miss a perforation waiting for rehydration to do nothing," he turned back. The room, there were 2 other nurses and a medical student in that bay, went very still. "Are you refusing a direct physician order?" She looked at him. The labs were in her hand. Merritt was on the gurney behind her, and his wife was sitting in the chair by the wall with her hands folded in her lap in the specific way people sit when they're trying not to fall apart. "I'm documenting my clinical concern," Emily said. "I need that on record." That was it. That was the sentence. Holt walked directly to the nursing station and picked up the phone. He had 3 words for whoever answered. Then he walked back to the bay entrance, crossed his arms, and waited. The medical student had already found somewhere else to be. Reyes was studying the wall. Randall Voss appeared in under 4 minutes. That was how fast he came, which told Emily exactly how close to the surface this had been sitting. Voss was tall, thin, the kind of institutional administrator who had learned to make authority look like reasonable concern. He spoke quietly and with a measured cadence that sounded like fairness until you listened to the actual content of what he was saying. "Emily, can we step outside? Mr. Merritt hasn't been cleared. Reyes will cover him." She looked at Reyes, who didn't look back. She followed Voss into the corridor. What happened next took less than 6 minutes. She was informed that her conduct had become a pattern of insubordination that was incompatible with the hospital's standard of care, that her employment was being terminated effective immediately, that security would escort her from the premises, and that her personal items would be collected and forwarded to her within 5 business days. He was professional throughout. He never raised his voice. He mentioned the word unfortunate twice. Porto appeared at her elbow almost before Voss finished talking. "I need to give report to whoever's covering my patients," Emily said. "Reyes has them. I have 6 patients active. One of them is potentially—" "Emily," Voss's voice went a register lower, not louder. "Don't make this harder than it needs to be." She stopped. She looked down the corridor at Bay 4, where Dale Merritt was lying on a gurney with a potentially rupturing appendix, while the hospital's chief of emergency medicine was ordering oral rehydration. She let Porto take her toward the exit. She told herself she'd call the state medical board from the parking lot. She told herself she'd find Merritt's wife's contact somehow. She told herself a lot of things in the 112 feet between the nursing bay and the front entrance. Porto had her right arm. A second security guard, someone she didn't recognize, had her left. They weren't rough about it. They were just steady and large and moving. The lobby was quiet for a Tuesday. A few people in waiting room chairs looked up. A man with a newspaper put it down. An elderly woman with a walker stopped moving entirely and just watched. The automatic doors slid open. Morning air came through. That was when the first vehicle rolled into the hospital's approach road. It was a black MRAD, a Military Research and Development Administration tactical transport, the kind of vehicle that belonged on a forward operating base and had absolutely no business on the two-lane approach road of a regional hospital in Ashcroft. Then came a second, then a third and fourth in quick succession, and by the time the noise registered fully in the lobby, there were 6 vehicles arranged in a loose formation across the hospital's front access, and people were getting out. Not in a hurry. Deliberately. Military bearing. Full tactical gear on some, service dress on others. And in front of them, boots on the asphalt, shoulders squared, reading the scene in about 3 seconds the way people do when they've been trained to read scenes quickly, was a man who introduced himself to no one, looked at the tableau of Emily between 2 security guards in the open doorway, and said, "Stand down. She goes nowhere." His name, she would learn later, was Commander Jared Vale. He was Special Operations, and he had a way of occupying space that made everyone in the immediate area instinctively reassess the situation they were in. Porto looked at Voss. Voss looked at Vale. Nobody moved for a full 3 seconds. "I don't know who you are," Voss said, "but this is a private medical institution, and I know what it is." Vale walked forward. Not fast. He didn't need to be fast. "We have multiple critical casualties inbound. ETA 6 minutes. I need your highest-rated trauma team staged and ready." Our trauma team is, "Where is Emily Carter?" The question landed in the middle of whatever Voss was about to say and simply stopped it. Vale was looking at Emily. At her, not at Voss, not at Porto. He had the look of a man confirming something he already knew. "Right here," she said. He nodded once. The expression on his face was not relief exactly. It was more like the specific absence of continued urgency, like a variable in a calculation resolving. "You're with us," he said. "She's terminated," Voss said. His voice had lost some of its measured quality. "Whatever you need from this hospital, I can provide you with our Chief of Emergency Medicine and our—" "Your Chief of Emergency Medicine isn't who I came for." One of the other military personnel, a woman in service dress with a tablet in her hand, stepped forward and said something quietly to Vale that Emily couldn't hear. He listened, looked at Emily again, and said, "How long have you been out of practice?" 6 years as an ER nurse. Before that, 4 years Army, combat medic, 2 tours forward deployed. "I know your record. I mean, how long since you've worked a field trauma?" The honest answer was longer than she'd like. The real answer was different. "I haven't forgotten," she said. Something passed across Vale's face. Not quite a smile, more like the acknowledgement that this was going exactly as he'd expected it to. "Good." He turned back to his vehicle. The casualties were coming in on the 4th and 5th vehicles. She could see now that they weren't all tactical transport. There were medical carriers in the convoy too, and the doors were opening, and people were moving with the specific controlled urgency of personnel who've been managing a crisis in transit and are relieved to finally be somewhere with a building. Voss stepped forward. "Commander, I need to understand the authority under which Department of Defense Medical Emergency Protocol, Section 14, Subsection C. Your facility is the nearest appropriate trauma center to the incident site. We are exercising requisition authority for emergency medical resources." He said it the way people say things they've said before and expect to only say once. "That means your building, your equipment, and," he glanced at Emily, "whatever personnel are necessary." She is not current hospital personnel. Vale looked at him for a long moment. The kind of look that communicated without any particular hostility that this conversation was over. "Carter," he said, without looking away from Voss. "Let's go." Emily was already moving. She caught a glimpse of Porto's face as she walked past him. He looked uncertain in a way that was specific and new, The expression of someone who has been holding a door closed and just realized he doesn't know what he's holding it against. Inside, the controlled chaos of an incoming mass casualty was beginning to assert itself over the normal controlled chaos of a Tuesday morning ER. Nurses were moving. Reyes had materialized near the trauma bay entrance with the look of someone who'd just been told his Tuesday was about to become a different kind of day. The medical student from earlier was gone. Vial was briefing her as they walked. 7 casualties. 3 are stable enough to hold for now. 4 are not. Lead casualty is a sergeant first class named Breck. 29 years old, blast injury during a training exercise that went wrong. There's a secondary injury complication that we were managing in transit, but we've hit a ceiling. He's lost pressure twice in the last 30 minutes. The medic team stabilized him both times, but he's trending wrong. What's the complication? Penetrating thoracic wound with a hemothorax and what we think is a vascular injury at the thoracic inlet. We need someone who knows how to open a chest in a non-ideal environment. She processed that. You're not asking for a standard chest tube. No. You're asking for someone who's cracked a chest under fire. I'm asking for someone who's done it before, yes. She'd done it twice. Once in a FOB medical station in the 3rd year of her 2nd tour, when the surgeon was 40 minutes out by helo and a special forces sergeant was dying on the table. The 2nd time in an improvised forward aid station with inadequate lighting and a trauma kit that was missing 2 items she'd worked around. Both patients had lived, which was not a guaranteed outcome of that particular intervention, on a good day in a fully equipped OR. She hadn't put that on her nursing resume. Holt should be informed that Holt can observe, Vale said. You're running the case. She didn't answer that. There wasn't anything to say about it. She was already thinking about lines and pressers and what she needed staged before the doors opened. The first casualty came through on a litter, and everything else stopped mattering. Breck, Sergeant First Class Darius Breck, she saw on the transit board, was 29 and looked it even underneath the gray pallor of significant blood loss. His color was wrong. His pressure, read out by the accompanying medic, a stocky woman named Tso, who had the focused efficiency of someone who'd been keeping this man alive on willpower and training for the last 90 minutes, was wrong. His breath sounds, which Emily checked with a stethoscope she'd grabbed from the wall rack in motion, were wrong in a specific way that confirmed the briefing and also told her there was less time than the briefing had implied. He's dropping into tension, she said. Not loudly, factually. That's what we were afraid of, So said. I need a thoracotomy tray. I need 2 large bore IVs if they aren't already in. How's his access? 2 peripheral lines, right antecubital and right external jugular. We burned through the left external getting him stable the 2nd time he lost pressure. Okay, I need type and cross if we haven't done it. Done in transit. We have 3 units of O-neg on the carrier. Get them up. And I need someone to tell Holt I need him or whoever's running his anesthesia team in this room right now because I'm not doing a thoracotomy without gas. She looked up. Holt was already in the doorway. He was looking at Breck. He was looking at the monitoring. And he was looking at Emily with an expression she didn't have a name for immediately. It was too complicated, too layered, the expression of a man whose certainties were rearranging themselves faster than his dignity could keep up with. You're not authorized to, he started. Can you put him under or not, she said. He looked at Breck again, at the pressure reading, at the waveform on the monitor that was doing something a waveform should not do. He didn't answer her question. He started scrubbing in. She took that as a yes. The tray arrived, so helped her stage it. Vial was in the doorway, not inside, not in the way, but present, which was its own kind of pressure that she put in a box and set aside. 3 other military personnel had positioned themselves in the corridor outside. The rest of the ER was continuing its mourning around this specific room, which was both the normal compartmentalization of an ER and somehow surreal given everything. She gloved. She looked at Breck. He was watching her. Barely. Through a pharmacological haze and blood loss and the specific weight of what was happening to him, and there was something in his eyes that was not quite fear. It was closer to the look she'd seen in forward aid stations. The deliberate decision to trust the hands in front of you because the alternative is not a decision at all. "I've got you," she said quietly. He didn't say anything. He closed his eyes. She picked up the scalpel. At the nursing station, 20 feet and a world away, Dale Merritt's monitoring system sounded a secondary alert for elevated heart rate and worsening pain score. His wife stood up from her chair. Nobody who was available to see it was looking at the monitor. The scalpel moved, and the room contracted around it. This was the thing about surgical intervention under pressure that nobody talked about in training. The world didn't slow down the way people said it did. It didn't sharpen into cinematic clarity. What actually happened was that everything irrelevant fell away, not gracefully but abruptly, like a circuit cutting out, and what remained was the work and the hands doing it, and nothing else. Emily made the incision along the fifth intercostal space with the controlled pressure of someone who had learned this not in a simulation lab, but in a concrete-floored medical station with a generator running outside and people shouting in 2 languages. The tissue layers separated cleanly. Breck's chest was in worse shape than the external presentation had suggested. She could see immediately that the hemothorax was larger than the transit imaging had indicated, and the vascular injury Vale had described was real and active, and not something she could finesse around. "I need suction right now," she said. The scrub tech, a young man named Ferris, who had appeared from somewhere and was handling himself better than she would have expected, put the sucker in her hand without hesitation. She cleared the field enough to see what she was actually dealing with. "Pressure?" she said. Holt, who was managing the anesthesia with the expression of a man in the middle of a very rapid internal revision, said, 72/40, down from 78. "He's still dropping." "I see that." She didn't say anything else. She was already working toward the vessel, and the geometry of it was bad. Not impossible, not even close to the worst she'd seen, but bad in the specific way that required her to make a decision about approach before she could commit to anything, and decisions like that had to happen in seconds, not minutes. She committed. So, who had stationed herself at the supply table without being asked and was anticipating what Emily needed with the efficiency of someone who'd scrubbed into field procedures before, had the retractor ready before Emily asked for it. That helped. What didn't help was that halfway through the exposure, Breck's pressure dropped again, this time to numbers that made Holt say something under his breath that wasn't medical terminology, and the cascade that followed required Emily to switch from deliberate to immediate without losing the progress she'd made. She packed. She compressed. She held pressure manually while So pushed the 3rd unit of Oneg, and Holt adjusted his pressors, and 30 seconds felt like it occupied its own separate stretch of time. "Holding," Holt said. "Still holding?" "Yes. Barely." "Okay." She exhaled. Not relief, just the physical requirement of continuing to breathe. "Okay." She resumed. It took 41 minutes. She knew that only because someone told her afterward, inside the procedure, time had reduced to a sequence of steps, and she had no attachment to the duration of any of them. What she knew was that she repaired the vascular injury, evacuated the hemothorax adequately, placed the drain, and closed. She knew that Breck's pressure stabilized at the 40-minute mark and continued stabilizing after that. She knew that when she stepped back from the table and peeled her outer gloves, her hands were shaking slightly, not from uncertainty, just from the sustained muscular tension of precise work under sustained physical stress. That was normal. That had always been normal. What was not normal was Holt. He was looking at her from the head of the table with an expression she didn't have a category for. Not admiration, exactly. Something more complicated and less comfortable than that. The look of a man who has spent years sorting people into known quantities and has just discovered his sorting mechanism has a significant flaw. She didn't address it. She stripped her gown and turned to So. "How are the other 3? "2 are stable and holding. The 3rd, So paused, checked her radio. "They're asking for you on the 3rd. "What's the presentation?" "Blast injury, lower extremity, tourniquet in place since the incident site. He's been on for," she looked at her watch, 73 minutes. Emily was already moving. The 3rd casualty was in Bay 2, which was normally a general intake bay and was not set up for the level of intervention he needed, a fact that was visible immediately and that someone was going to have to solve in the next few minutes. His name, from the board, was Specialist Anaru Mafi, and he was 22 years old and fully conscious and in the specific kind of sustained agony that comes from knowing exactly what's wrong with you and being unable to do anything about it. He was also the most frightened she'd seen anyone look in a long time, which he was covering with varying degrees of success by staring at the ceiling and being very still. "Hey," she said, stepping into his line of sight. He looked at her. His jaw was tight. "Is Breck okay?" "He's stable." Something in his face eased, not much, but something. "What's your pain level?" "It doesn't matter." "It does, actually. Tell me." 8. It was probably higher than 8. She could see from the degree of guarding and the set of his shoulders that it was probably closer to 10, but 22-year-old soldiers frequently undercounted pain as a matter of reflex, and she wasn't going to argue the number. "Okay," she said, "we need to evaluate the limb before we talk about next steps. I'm going to be straight with you. 73 minutes is a long time on a tourniquet. I need to see what we're working with." "Will I lose it?" She looked at him directly. "I don't know yet. I need to look first." He nodded. He went back to staring at the ceiling. She did the assessment. It was not a simple picture. The injury itself was significant, a fragment wound with substantial soft tissue involvement in the mid-thigh. But the more immediate concern was vascular, and when she did the Doppler assessment, the signal distal to the tourniquet was weak in a way that could mean several things, some of which were much worse than others. She needed a vascular surgeon. Blackwood Regional had one. His name was Dr. Petrov, and he was in the building. She'd seen his name on the board that morning. But whether he was currently reachable and whether he could be persuaded to take direction from a nurse who'd been terminated 40 minutes ago were different questions. She went to the bay phone and called the OR desk. "I need Petrov down here. Bay 2. Vascular assessment on a military casualty. Probable FEM involvement. Tourniquet 75 minutes." A pause. "Who is this?" "Emily Carter." Another pause, longer. "Ms. Carter, I was informed that you are no longer—" "I know what you were informed. Get Petrov." She hung up. Vale appeared in the bay entrance. He'd been moving through the department with a quiet steadiness since the convoy arrived, not interfering, not demanding, but present in a way that was itself a kind of force. "Where are we?" he said. "Breck is stable post-procedure. Mafi needs vascular surgery evaluation, and I'm having some interdepartmental friction about who gets to order it." Vale looked at her for a second. Then he turned and spoke to someone in the corridor. She couldn't hear exactly what he said. And whatever it was, Dr. Petrov appeared in Bay 2:11 minutes later, which was significantly faster than the normal process would have produced him. Petrov was older, methodical, with the deliberate manner of a surgeon who had been doing this long enough to be unhurried about almost everything. He assessed Mafi without speaking for a while, looked at her assessment notes, looked at the Doppler readout, and said, "He needs the OR. Now, not in an hour." "I know. Who authorized your clinical involvement here?" "Department of Defense Emergency Protocol," she said. "Section 14. He looked at her over his glasses. "You're the ER nurse they walked out the front door this morning." "Yes." He considered this. "Your assessment of the vascular status is consistent with mine," he said, which for Petrov, she suspected, was approximately equivalent to a standing ovation. "I'll take him up." She exhaled. "Thank you." He was already ordering the OR prep. She turned back to the bay and found Mafi watching her. "You got fired, and you're still here," he said. It wasn't quite a question. "Your people needed help." He was quiet for a moment. "Breck's really okay?" "He's really okay." He nodded slowly, like he was filing that somewhere important. Then the transport team arrived, and he got moved, and she had 3 other casualties still waiting, and the morning continued its relentless accumulation of everything at once. What she didn't know, what nobody in the trauma bay or the ER corridors or the administrative wing was paying attention to yet, was that Dale Merritt had been quietly deteriorating in Bay 4 for the past hour. She found out because his wife came and found her. The woman, her name was Patricia Merritt. And she was the kind of person who had clearly spent the last hour trying not to bother anyone, while also becoming increasingly certain that someone needed to be bothered, appeared at Emily's elbow between the third and fourth casualty assessments with a look that was equally apologetic and desperate. "I'm sorry," Patricia said. "I know you're dealing with... I can see this is a lot. But my husband, they haven't done any tests. They just gave him something for the pain and told us to wait. And he's hurting worse than when we came in, and I don't..." "Bay 4?" Emily said. "Yes." "How long since anyone checked on him?" Patricia looked at her watch. Her expression said the number was too long. Emily changed direction. Reyes was not in Bay 4. The monitoring system was alarming in a low-grade way that indicated someone had acknowledged the alert and adjusted the threshold rather than addressing the cause. Merritt was lying on his side with his knees pulled up. Fetal positioning, classic guarding for peritoneal irritation, and his color was significantly worse than it had been 2.5 hours ago. She assessed him in under 3 minutes. His abdomen was rigid, his fever had climbed, his heart rate was elevated in a way the adjusted monitor threshold was successfully hiding from anyone who wasn't looking directly at the patient. This was a perforation. It might already be a peritonitis. She went directly to the nursing station and pulled Reyes's number. "He's perfed," she said when he picked up. "Bay 4. Merritt. He needs a surgical consult, and he needed it an hour ago." A silence. "Carter, I don't know if you should be... I don't care what I should be. Look at the man in Bay 4 and tell me I'm wrong." Another silence. Longer. "I'll look at him," Reyes said. She waited. She was standing at the nursing station with one eye on the corridor toward Bay 4 and one eye on the military triage board, and the split attention was making her temples ache in a way she'd been ignoring for the last hour. Reyes came back on in 4 minutes. "You're not wrong," he said. He sounded like a man who had just made a decision that he'd been avoiding making and was not entirely comfortable with the relief that followed it. "Surgery consult, now." "I know." "And get his wife out of that bay before they prep him. She's been sitting in there alone." He paused. "Okay?" She put the phone down. Vale was standing 6 feet away. She hadn't heard him approach, which said something about the current state of her situational awareness. "The civilian patient," he said. "Appendicitis that went to perforation while nobody was watching him because the physician who should have ordered imaging 40 minutes before I got fired decided oral rehydration was sufficient." She said it flatly. Not performance, not self-pity, just the clinical facts arranged in order. Vale's expression didn't change, but something behind it did. "Is he going to make it?" "If they get him into surgery in the next hour, probably yes. If they wait longer than that, the odds change." "Then let's make sure they don't wait." He said it simply, and she believed him, which was interesting because she'd known this man for less than 2 hours. There was something about the way Vale operated, not commanding in the theatrical sense, just relentlessly purposeful, that made his statements feel like facts rather than intentions. She was about to respond when her name was called from the trauma bay. Tso's voice, calm, but with a specific edge to it that Emily had already learned to distinguish from the general background noise of controlled urgency. She moved. Breck's pressure had dipped again. Not into crisis, not yet, but the trend line was concerning, and so had identified a new variable. His drainage output in the last 20 minutes was higher than it should be for a secured closure. Either the repair was holding and something else was bleeding, or the repair was not holding as well as it needed to. She looked at the drain. She looked at the output. She did the math in her head. "We need to image him," she said. "Right now." "Portable?" "Portable won't give me enough. I need him in CT." "He's not stable enough for..." "I know what the protocol says. He's not stable enough to not know what's happening inside him either. We move him with a full escort, we manage him in transit, and we get the image." She looked at Tso. "Can you do that?" Tso didn't hesitate. "Yes?" "Then let's go." They moved Breck to CT with 3 people managing his lines and a military medic from the convoy running the pressure cuff manually in the corridor because the transit monitor had a sensor failure that nobody had time to troubleshoot. The image took 6 minutes to acquire. Emily was looking at it before the technician had finished the formal read. She saw it immediately. There was a secondary bleed, small but active, from a vessel adjacent to the primary repair site. Not a failure of her work, a separate injury that the initial field imaging had missed and that the hemothorax had partially obscured during the procedure. It happened. It was the kind of thing that happened in multi-trauma cases, especially ones that had been managed in transit for 90 minutes before reaching a facility. It was also the kind of thing that would kill him if it wasn't addressed. She pulled out the image and walked back toward the trauma bay and found Holt standing in the corridor outside it. He was alone. He had his arms crossed and the expression of a man who had been standing there for a while, working through something. She held up the image. He looked at it. His jaw moved. He looked at her. "There's a secondary vessel," she said. "I see it. He needs to go back in." "I know." He uncrossed his arms. He looked like he wanted to say something and was choosing between several options. What came out was, "I can assist." She looked at him for a moment. Not surprised exactly. Something more like the recognition of a shift. Small, incomplete, but real. "Then scrub in," she said. She was already walking. What she didn't see, because she was already back inside the trauma bay, was Randall Voss standing at the end of the corridor with his phone to his ear, his face carrying an expression that was no longer the measured professional concern of a hospital executive managing a difficult morning. It was the expression of a man who was making calls he thought nobody was watching him make. And 3 feet behind Voss, in the half-shadow of the corridor junction where the administrative wing met the ER access, a woman in civilian clothes was photographing him with her phone, unhurried, methodical, capturing each call in sequence. Her name was Special Agent Dara Lund, and she had arrived in Ashcroft not with the military convoy, but 2 days before it, and she had been inside this building longer than anyone currently in it knew. Lund put her phone away with the same unhurried precision she'd used to take the pictures. She didn't move immediately. She stayed in the shadow of the corridor junction and watched Voss finish his call, watched him look at his phone screen for a long moment after it ended, watched him make the calculation visible in his posture, the slight forward roll of the shoulders, the breath that went out slower than it came in, before he straightened and walked back toward the administrative wing with his measured stride restored. She waited 10 seconds. Then she walked in the opposite direction. She had what she needed from Voss. What she needed now was inside the hospital's administrative server infrastructure. And that was a problem she'd been working on for 47 hours. And this morning's events had just handed her a window she hadn't anticipated having. 2 days ago, when Lund had arrived in Ashcroft under credentials identifying her as a healthcare compliance consultant, contracted to review Blackwood's billing infrastructure, she had expected to spend at least a week building the evidentiary picture before anything visible happened. The complaint that had triggered her investigation had come through a federal whistleblower channel, an anonymous submission with enough specific detail about the billing fraud to warrant a preliminary field assessment before a full federal inquiry was authorized. The submission had included partial documentation, enough to establish probable cause for deeper access, not enough to make an arrest. She had identified Emily Carter's compliance emails within the first 6 hours of her access review. She had also identified the fact that those emails had been read by Strike, the compliance officer, and then forwarded, not to the oversight committee, not to the board, but to Randall Voss directly, within 90 minutes of receipt. She had identified 3 other things that Emily Carter did not know about herself. 1. Carter's military service record had a classification flag on a specific portion of it, not unusual for someone who'd served in specialized forward medical roles. But the flag had been accessed twice in the past 72 hours by parties outside the normal personnel access chain. 2. The federal reimbursement fraud at Blackwood was not limited to supply billing. The supply discrepancies Carter had found were the surface layer. Underneath them was a procurement kickback arrangement between Voss, a regional medical supply distributor, and 2 members of the hospital's board of directors that had been running for over 2 years and had diverted an amount of money that would, when the full accounting was done, be significantly larger than anything Carter's printout suggested. 3. The timing of Carter's termination, specifically the speed of it, the same-day execution after years of employment, the manufactured complaint, the immediate security escort, was not the action of an administrator protecting institutional order. It was the action of a man who had just realized that someone inside his building had found the edge of something he could not afford to have found. Voss hadn't known who Carter had told. He still didn't know about Lund. What he knew was that Carter was a variable that had become dangerous, and he had eliminated her the way administrators eliminate variables, through process, paperwork, and the institutional authority to redefine insubordination as whatever the situation required it to mean. What he hadn't accounted for was that eliminating Carter would create exactly the kind of documented retaliation event that a federal investigation needed as its anchor. Lund turned the corner toward the administrative wing and thought about the fact that Voss's call, from what she'd been able to lip-read from her position in the corridor shadow, appeared to have been to someone whose contact was saved under a first name only. That was interesting. People in institutional roles saved contacts under full names and titles. First name only contacts in the phone of a hospital executive in the middle of a federal fraud event were not personal friends. They were lawyers, or they were the kind of people you called when you needed something to disappear quickly. She increased her pace. Inside the trauma bay, Emily was 40 minutes into the second procedure on Breck, and Holt was across the table from her doing something she hadn't expected him to do, his job well. She hadn't lowered her assessment of him. What he'd done to Merritt that morning remained what it was, and the patterns behind it remained what they were, but she was capable of holding two things simultaneously. He was a man whose authority had curdled into something harmful over time, and also a technically competent surgeon when the situation removed his options for posturing. He was both of those things at once, and she needed the second one right now. There, he said, identifying the secondary vessel from his angle before she'd fully repositioned her retractor. I see it. The approach from your side is going to be I know. She was already adjusting. I need you to hold lateral traction while I get under it. He did. He didn't add commentary. That was new. The secondary bleed was smaller than the first, but in a location that required more patience than force. And patience was something she had in specific quantities. Not infinite, not performed, but genuine. The kind built from situations where moving too fast had real consequences she'd lived through. She worked toward it with deliberate increments while the monitors ran and so called out pressure readings every 90 seconds, and the room maintained the particular focused silence of people doing difficult things correctly. It took 23 minutes. When she secured the vessel and stepped back, the drain output had already begun to change. Not dramatically, not immediately, but in the direction it needed to go. Closing? Holt said. Yeah. He began the closure. She watched for 30 seconds to confirm the field was stable, then stripped her outer gloves and moved to the monitor. Breck's pressure was 94/61. Not good numbers. Moving in the right direction. So looked at her from across the table. Something in her expression said, that was something. So didn't say it aloud, but it was there. Emily nodded once and left to check on the remaining casualties. The next 40 minutes were a different kind of hard. The administrative and logistical hard, the kind that required a different set of resources and produced a different kind of fatigue. The two stable casualties needed monitoring and documentation and communication with their unit medical officer, none of which could happen through normal hospital channels. Because Emily was still technically a terminated employee, and the workaround that Vale had established under emergency protocol had not been formally papered in a way that gave her standing to enter orders or sign documentation. She worked around it. She assessed, she communicated findings verbally to Tso, who relayed them through channels that had standing. She caught three things that would have been missed in the transition, and she felt the particular exhaustion of being competent in a system that was actively organized against recognizing that competence. Vale found her between the fourth and fifth casualty assessments. He didn't open with pleasantries. Merritt's in surgery. Reyes got him up there 20 minutes ago. Is Petrov? Petrov had already finished with Mafi. He took Merritt himself. She exhaled. 20 minutes ago. That was closer than it should have been, but not too late. And Mafi. Out of surgery, limb intact. Petrov says the vascular repair held and the tissue viability looked better than the tourniquet time suggested. He paused. He said to tell you the Doppler assessment was accurate. It usually is. Vale looked at her for a moment. You trained at Kirkland? She blinked. That was not a question she'd expected. My second tour. Why? I knew your unit commander there, Metzger. She hadn't heard that name in 4 years. It landed in an unexpected place. Metzger's a good officer. He mentioned you, not recently. This was a few years back at a training evaluation debrief. Said his best field medic had left the Army and he couldn't figure out why. She didn't answer that immediately. The why was complicated and personal and not relevant to the current situation, and she was also genuinely tired of this particular conversation, which she'd had in various forms more times than she could count. The version where someone tells her she's wasted in civilian work, as if the choice to leave had been a failure of some kind rather than a decision made for reasons that were her own. I left because I was ready to, she said. That's all. He accepted that without pushing it. That went up in her assessment of him. I need to tell you something, he said, and I need you to hear it before it comes at you from a direction that's harder to process. She looked at him. When my office requested emergency routing to Blackwood this morning, we were working from a current capabilities assessment. That assessment flagged you as the highest qualified trauma resource within 40 minutes of the incident site. It wasn't random that we came here. He paused. But there's more to it than that. The flag on your file, the specific reason we had a current assessment on a former Army medic working in ER in Ashcroft. That flag came from a federal investigative request made 4 days ago. The shape of what he was saying took a moment to assemble. Someone requested an assessment on me 4 days ago, she said. Yes. 4 days ago is when my billing system access got revoked. I know. That's not a coincidence. No, he said. It's not. She thought about what that meant. The timeline, the sequence of events, the specific 4-day gap between her second compliance email and this morning. It meant someone had known she was under scrutiny before she'd been terminated. It meant the termination wasn't a reaction to this morning's confrontation in the ER bay. It had been planned. This morning's confrontation had just been the mechanism. Is there an ongoing federal investigation, she said, into this hospital? Vale held her gaze. That's not a question I'm in a position to answer right now. Which was itself an answer. Okay, she said. She heard how flat her own voice sounded. She didn't adjust it. Okay. Emily. He used her first name for the first time. What you found in those billing records, you kept copies? In my locker, which I no longer have access to because my badge was deactivated this morning. We'll need those. I know. He said something into his radio, and she turned back to the ward because there were still patients who needed someone paying attention to them, and the corridor conversation would wait, and the patients would not. What happened next came from a direction she hadn't been watching. It was Quan, the HR representative from the administrative review meeting 2 days ago, the woman who'd spent that meeting studying her own shoes, who appeared at the ER entrance at 11:43 a.m., looking like someone who had made a decision that had cost her something and was still not sure she'd survive the cost. She was looking for Emily specifically. Emily saw her from 30 feet away and recognized the look. She'd seen it before in people who'd been carrying something heavy for a long time and had finally run out of strength to keep carrying it. She walked over. Quan said, without preamble and in a voice just above a whisper, the review meeting 2 days ago, the patient complaint they cited. There was no complaint. Emily waited. Voss instructed me to file the documentation using a complaint template. There was no complainant. The file number doesn't correspond to any actual patient submission. I created the document because he told me to, and She stopped. Her jaw was working. I have the original email from him asking me to create it. I kept it. I don't know why I kept it. I kept it, and I want to give it to someone who... There are federal investigators in this building right now, Emily said. Quan blinked. Something in her face went through several rapid changes. There are. Yes. Emily looked toward the corridor junction where she'd last seen Vale. I can make sure someone talks to you today, right now, if you want. Quan pressed her lips together. Her eyes were bright in the way eyes get when someone is running on adrenaline and sleep deprivation and the specific relief of a decision finally made. Yes, she said, right now. Emily found Vale. He took one look at Kwan's face and understood the category of the situation without needing it explained. He made a call, and 8 minutes later, Kwan was in a private administrative room with two people who were not hospital staff and were not identifying themselves as federal agents, but who were asking very specific questions in a very specific order. Emily went back to work. It was Ferris, the scrub tech who'd been in the trauma bay during Breck's first procedure, the young man who'd handled himself better than expected, who found her at 12:15 at the supply station where she was doing an inventory reconciliation that nobody had asked her to do, but that needed doing because 3 hours of emergency trauma had moved enough materials that someone needed to account for them. "Dr. Holt wants to speak with you," Ferris said. "He's in the staff lounge." She looked up. "Did he say about what?" "No, he just—" Ferris hesitated. "He looked like it was important." She set down the inventory sheet and went. Holt was sitting at the table in the staff lounge with a coffee he wasn't drinking and the posture of a man who had made a significant internal journey in a short period of time and was not entirely sure where he'd landed. He looked up when she came in. He didn't tell her to sit. She didn't sit. "I ordered the labs on merit this morning," he said. She waited. "I looked at the same presentation you looked at, and I ordered oral rehydration because it was the simpler explanation, and I wanted it to be the simpler explanation." He was looking at the table, not at her. "I've been doing this for 22 years. I know what right lower quadrant pain and an elevated white count means." "Yes," she said. "You do." He looked up at that. He'd probably expected something softer. She didn't have something softer available. "Is he going to be all right?" "Petrov says yes, if there aren't complications." He nodded. He looked back at the table. "What you did this morning, in there, the thoracotomy, the secondary repair set—" "Don't," she said, not harshly, just clearly. He looked at her. "Don't make it about the procedures," she said. "Make it about why you let me get walked out the front door of a department where I'd been catching problems and saving patients for 6 years because I documented a clinical concern you didn't want documented." He didn't answer for a long moment. The coffee sat between them, cooling. "I know," he said finally. It was 2 words, and they carried a weight she hadn't expected from him, and she didn't know what to do with that weight immediately, so she left it where it was. "I need to get back to the ward," she said. She left him there. At 12:47, the first official action happened. She was at the nursing station when she heard the shift. Not a sound exactly, but a change in the quality of the ambient noise in the administrative corridor. The kind of change that happens when people are moving with purpose rather than routine. She turned. 4 people were walking toward the administrative wing. 2 of them were in suits she recognized as the civilian clothes personnel who'd been speaking with Kwan. The third was a man in state authority insignia she'd noticed at the edge of the military convoy earlier but hadn't placed. The fourth was someone she'd never seen, middle-aged, carrying a leather document case, wearing the expression of a person with a specific authority to be in a building and a specific task to execute within it. They didn't go to Voss's office. They went to the server room. She watched them badge through the security door. They had their own credentials, not hospital-issued, and the door closed behind them. Ferris appeared at her elbow. "What's happening?" "I don't know exactly," she said, which was mostly true. Her phone buzzed. Unknown number. She answered. "Ms. Carter." A woman's voice, measured, efficient, with the specific cadence of someone who was very comfortable being direct. "My name is Special Agent Dara Lund. I'm currently in your hospital's administrative infrastructure. I need to speak with you as soon as you have 5 minutes that won't compromise patient care." Emily looked at the closed server room door. "Are you the compliance consultant who arrived 2 days ago?" A brief pause. "I'm impressed." "Yes." "Give me 15 minutes. She went back to the ward and triaged what could be handed off and what couldn't. Most of it could. Breck was stable and being monitored by Zoe with a focus that amounted to protective custody. The 2 remaining casualties were stable and had their own medical personnel covering them. Mafi was post-op and doing better than the 73-minute tourniquet time had suggested he should. She found Lund in a small conference room off the administrative corridor at 1:03 p.m. Lund looked exactly like what she was: organized, watchful, wearing a credential she didn't volunteer and didn't need to. She had a tablet on the table in the kind of stillness that isn't passive. It's the stillness of someone who is constantly processing. "You found the billing discrepancies 3 weeks ago," Lund said. It wasn't a question. "Yes." "And you documented your concern twice through the compliance channel before your access was revoked." "Yes." "The compliance officer, Strike, forwarded your emails to Voss within 90 minutes each time." That was the piece Emily hadn't known. She absorbed it without letting her face do anything in particular about it. "How long has the investigation been running?" "Formally, 11 days. Informally, longer." Lund looked at her directly. "The scope is broader than what you found. What you found was the edge of a procurement fraud arrangement that involves Voss, the primary medical supply distributor for this region, and 2 board members. The billing irregularities you documented are one component. The federal reimbursement element, the insurance coding fraud, the inflated billing to federal programs, that's the part that brought us in." Emily thought about 14 months of supply records. She thought about the numbers she'd added up at her kitchen table at 11 p.m. after her second compliance email went unanswered. She'd thought the number was significant. Apparently the number she'd found was the visible fraction of something much larger. "How large?" she said. Lund named a figure. Emily looked at the table for a moment. "The patients," she said, "the ones affected by the supply shortages, the ones who got billed for materials that weren't part of the remediation process. Yes, that's not my division, but it's part of the broader case. There's a patient named Aura Tatum, 63 years old, admitted 6 weeks ago for demand ischemia. She was given a medication combination that I flagged as contraindicated given her renal function, and the order was upheld over my objection." Lund was typing. "Last name Tatum, Tatum? "Yes." "I'll flag it for the patient care review team." She looked up. "The documentation you have in your locker, we need to retrieve it." "My badge access was deactivated." "I know, I've arranged for escort." She paused. "Ms. Carter, I want to be transparent with you about something. The termination this morning, the manufactured complaint, the immediate security escort, the speed of the whole thing, that's going to be part of the retaliation documentation in this case. What was done to you this morning is legally significant." Emily hadn't been thinking about it in those terms. She'd been thinking about Breck and Maffei and Merritt and the inventory and the thing Holt had said in the staff lounge and approximately 40 other things simultaneously. She hadn't been thinking about herself. "Okay," she said. "Are you all right?" The question landed with an unexpected weight. Not because it was remarkable, because nobody had asked it yet. "I'm functional," she said. Lund studied her for a moment. "That's probably the most honest answer I've gotten from anyone in this building today." Emily almost smiled. It surprised her. They stood up together, and Lund was reaching for her tablet when the conference room door opened without a knock. It was one of the suited personnel from the server room. His expression was the specific controlled alarm of someone delivering information that has just changed the shape of everything. "We have a problem," he said. Lund turned. "What kind?" "The billing server. Someone initiated a remote wipe command 14 minutes ago." He looked at his tablet. "It's still running. We have a partial extraction, but if it completes..." "Who initiated it?" "The credential trace comes back to a terminal in..." He checked. "The hospital director's office." Lund was already moving. She was out the door and into the corridor before Emily had fully processed what she'd just heard. And Emily followed because the alternative was standing in a conference room while the evidence that would determine whether any of this morning meant anything was being systematically deleted from a server 14 feet below the administrative wing. The corridor to Voss's office was 40 meters and a security door. Lund badged through. Emily followed. They were moving fast but not running, which was a specific kind of controlled urgency that meant something was very wrong. They reached Voss's office, and Lund opened the door without knocking. The office was empty. The computer terminal was on. The screen showed a progress bar that was at 63%, and the window behind Voss's desk, the one that overlooked the hospital's side access road, was open. Lund took one look at the open window and spoke into her radio with a single sentence that Emily didn't fully hear because she was already looking at the terminal and the progress bar and the number 63 that was becoming 64, that was becoming 65, and thinking about what 65% of a deleted evidentiary database meant for every patient who had been defrauded, for Kwan and her preserved email, for the past 3 weeks of her own life. And she sat down at Voss's terminal and looked at what was running and tried to determine whether there was anything she could do about it. She wasn't a systems technician. She wasn't trained in data recovery or server administration. What she was someone who had spent 6 years inside this hospital's administrative infrastructure as a working nurse, signing orders, pulling records, navigating the EMR system, and who had spent the past 3 weeks inside the supply management system specifically, and who had, in the course of those 3 weeks, learned that Blackwood's server setup had a specific architecture involving a secondary backup partition that the primary system wrote to on a staggered delay. The primary server was being wiped. If the secondary partition hadn't been included in the wipe command, if whoever had initiated this had done it quickly, under pressure, using only the primary terminal commands, then there was a backup copy of everything that had been deleted so far. She navigated to the backup partition directory. It was there, and the wipe command had not been applied to it. She looked at the progress bar, 71%. She looked at Lund, who was on her radio coordinating and who looked over at Emily with an expression that asked a question. "The backup partition," Emily said. "Is it accessible from the outside?" Lund relayed the question. The suited man from the server room came back on with an answer in 45 seconds. If they could get a direct cable connection from this terminal to the extraction unit in the server room, they could pull the secondary partition before the primary wipe completed and the system began cascading to secondary targets. 81%. "How fast can you get the cable up here?" Lund said into her radio. The answer came back, 3 minutes. The progress bar hit 86. Emily looked at it. She looked at Lund. She looked at the open window through which Randall Voss had apparently decided his best option was to leave the building through a first-floor window like a man who had run out of better ideas. And then her phone rang. It was a number she didn't recognize. Area code she didn't know. She answered it because this was the kind of morning where unknown numbers sometimes mattered. The voice on the other end was male, unhurried, and said, "Ms. Carter, my name is not important right now. What is important is that you stop whatever you're doing at that terminal immediately." She went very still. "I know where you are," the voice said. "I know what you think you found. And I want you to understand something before the next few minutes make things very complicated for you personally." The progress bar hit 89. Emily didn't move her hand from the keyboard. The progress bar hit 91. "I'm going to need you to be more specific," she said into the phone. The voice on the other end didn't shift register. It stayed unhurried in the way that voices stay unhurried when the person speaking has calculated that urgency would cost them something. "What you're looking at in that partition, the secondary records, the procurement files, the insurance coding documentation. There are names in those files that go beyond this hospital. People who are not going to allow a terminated nurse and a mid-level federal agent to walk those records out the front door." Huh? "I'm not threatening you, Ms. Carter. I'm explaining a situation." "You're threatening me," she said. "You're just doing it in the register that people use when they want to feel like they're not." A brief pause. The first one. "Walk away from the terminal. Leave the building. What happens at Blackwood Regional from this point forward doesn't need to involve you." 93. Lund was watching her. She'd stopped her radio communication and was listening to Emily's side of the call with the focused attention of someone who was running multiple tracks simultaneously and adding this one to the stack. Emily looked at the progress bar. She thought about the calculation. 93% of the primary server wiped, the secondary partition still intact, the extraction cable 3 minutes away when this call started, and now probably 90 seconds away given that the suited man in the corridor had been moving fast. She thought about Ora Tatum, 63 years old, given a contraindicated medication combination because the physician who overruled the concern had a culture of unchecked authority built over 22 years of nobody pushing back. She thought about the supply coordinator Bryce, who had gone quiet in a specific way when Emily raised the discrepancy, not confused, not annoyed, but quiet like someone who'd already decided not to see something and had been living with that decision long enough that it had its own weight. She thought about Kwan in the administrative review meeting 2 days ago, studying her shoes. All of it connected, not through conspiracy exactly. Conspiracy implied a level of active coordination that was probably less accurate than something more mundane and more pervasive. A culture in which people had learned, one by one, that the cost of seeing something was higher than the cost of not seeing it. Voss hadn't needed to orchestrate every piece. He just needed to make the cost visible enough, consistently enough, that the institution had organized itself around protecting him. Until Emily had found something she couldn't unsee and sent emails she couldn't unsend and stood in a medication bay at 7:45 in the morning and said, "I need that on record," to a man who didn't want it on record and got walked out the front door for it. 95. "I'm going to hang up now," she said. "Ms. Carter, if you're going to do something, do it. But I'm not walking away from this terminal." She ended the call. Lund looked at her. "Who was that?" "Someone who wanted me to stop what I'm doing." "Did you recognize the voice?" "No." Lund was already on her radio. The door to the office opened and the suited man came in with a cable and a portable extraction unit that looked like a ruggedized external drive with federal agency markings on the casing. He moved to the terminal without ceremony, connected the cable to the secondary port, ran a command Emily could see but not fully parse, and looked at his unit's display. "Partition is readable," he said. "Pull it," Lund said. 97 on the primary wipe. The extraction began. The suited man, she still didn't know his name, watched his display with the flat concentration of someone monitoring a process that didn't need him to do anything except not interfere with it. Lund moved to the window Voss had used and looked down at the side access road, where 2 of the military personnel from the convoy had positioned themselves without being asked, apparently on Vail's standing instruction. "Voss is in the building's perimeter somewhere," Lund said. "He didn't get far." "How do you know?" "Because the only way out of the side road on foot leads to the hospital's loading dock and then the main parking structure, and we have people on both." She paused. "He didn't have a plan for this. He had a panic response." 100. The primary server wipe completed. The terminal screen shifted to a clean state. No files, no records. The digital equivalent of a cleared desk. The extraction unit was still running. "How long?" Emily said. 8 minutes, the suited man said. "Maybe 10. She sat and waited. Lund sat and waited. Lund. The suited man stood and watched his display. Outside in the hospital, the day continued, the afternoon shift coming on, the morning cases cycling through recovery, the specific ambient noise of a working trauma center that had absorbed an extraordinary morning and was now, on its surface, functioning normally. At the 8-minute mark, the extraction unit beeped once. "Complete," the suited man said. He unplugged the cable, checked the unit's display, checked it again, and looked at Lund. "Full partition. Everything that was on the secondary backup before the wipe initiated. The stagger delay was 42 minutes, so we have everything up to approximately 12:47. Lund looked at Emily. "The wipe started at 12:48? "Give or take," Emily said. "Then we have it all." What happened in the next 20 minutes happened in the institutional way that significant things often happen, not with drama exactly, but with the specific weight of process. 2 additional federal personnel arrived at Blackwood Regional, these ones identifying themselves formally and presenting documentation to the hospital's acting administrator, a woman named Foy, who had been the assistant director and who, in Voss's sudden absence, had inherited a situation she was clearly not prepared for and was handling with the slightly dazed competence of someone who has just been handed a steering wheel on a moving vehicle. Foy cooperated fully. She had the look of someone who had been suspicious of certain things for a long time and was simultaneously relieved and terrified by the current turn of events. The federal documentation authorized a full records hold on all hospital administrative functions, effective immediately. Billing operations were suspended. Procurement activities were frozen. 2 board members, whose names Emily didn't know but Lund apparently had flagged before walking into the building 2 days ago, were notified that they were subjects of a federal investigation and instructed not to leave the state. Strike, the compliance officer, was located in his office on the 3rd floor. He had apparently been in his office all morning, and when the federal personnel knocked on his door, he opened it immediately and said, according to Lund's summary afterward, approximately 400 words in under 90 seconds, most of which were useful and some of which were very useful indeed. Voss was found in the hospital's parking structure at level 2, sitting in his car, which he had not started. When the federal agent reached the vehicle, Voss's phone was on the passenger seat with an active call that he'd apparently forgotten to end, and the person on the other end of that call was still talking. Emily learned all of this in fragments over the following 2 hours, between patient checks and the ongoing management of the military casualties, and a conversation with Foy about the operational status of the ER that was administrative in nature but had underneath it the specific subtext of a woman trying to assess how badly things were going to get before they got better. She was checking Breck's drainage output for the third time that afternoon when Vale appeared in the trauma bay doorway. "They have Voss," he said. She didn't look up from the drain measurement. "I heard. The phone call you received in the office. The person who told you to walk away. That call came from a cell registered to a name that links to the supply distribution company involved in the procurement arrangement with Voss." She looked up at that. "So not a lawyer," she said. "No. Someone with a specific financial interest in the evidence on that server not being recovered." He paused. "The call is now part of the record. Whoever made it added obstruction to an existing fraud exposure, which is not bright." "Not bright," he agreed. She replaced the drain measurement notation in Breck's chart, the paper chart, because the electronic system was currently under hold, and moved to his bedside. He was conscious, more present than he'd been that morning, the specific sharpening that happens when someone has come back from a significant physiological crisis and their body starts reasserting itself. He looked at her. His voice was rough from the intubation but functional. "You're still here." "Still here." "Heard you went back in, second time." "The first closure held," she said. "There was a secondary vessel. It needed attention." He was quiet for a moment. "So told me what you did, in the first one, the approach you used." "Zoe talks too much." Something shifted in his face that was almost a smile. She said it was a Kirkland technique. "It's a technique. Kirkland is where I practiced it enough to be confident." "I was at Kirkland," he said. 3 years ago, junior cycle." She hadn't known that. She looked at him for a moment. 29 years old, blast injury, second surgery in a day, lying in a trauma bay in a regional hospital in Ashcroft because a training exercise had gone wrong in ways that would be debriefed and documented and probably changed the protocols for the next cycle, and thought about the specific smallness of the world in ways that were sometimes hard to know what to do with. "Rest," she said. "Yes, Sergeant," he said, and closed his eyes. And she wasn't sure if he was being serious or not, and decided it didn't matter. The afternoon was beginning to turn toward late when the shape of everything shifted again. She was at the nursing station doing the reconciliation work that had accumulated over the course of an extraordinary day, not because anyone had asked her to, not because her status in the building was clear enough to formally authorize it, but because it needed doing, and she was the one present who understood the current state of the inventory and the census, and the gap between where things were and where they needed to be, when Holt came to stand beside her. He stood there for a moment without speaking. She kept writing. "Merritt is out of surgery," he said. "Petrov says he'll recover fully." "Good." Another pause. "I called his wife. She wasn't..." He stopped. "She was not particularly interested in hearing from me." Emily put down her pen. She looked at him. He had the look of a man who had been very certain about something for a very long time, and was now standing in the specific cold that follows the loss of that certainty. "What did you want her to say?" Emily asked. He didn't answer. "Holt, what did you want her to say? That it's okay? That you caught it in time so the outcome was good enough? Because the outcome being good enough isn't what she was sitting with for the 4 hours her husband was deteriorating in Bay 4 while you had ordered oral rehydration." He looked at the wall. "You've got 22 years," she said. "You know how to be right a lot of the time, but you've built a department where the cost of telling you you're wrong is high enough that people stop doing it, and that is a patient safety issue regardless of how good your hands are. He didn't respond immediately. When he did, it was quietly. I know. Knowing is a start, she said. She picked up her pen. It's not sufficient, but it's a start. He stood there for another moment. Then he left. Reyes appeared 20 minutes later. He had the look of someone who had been building up to something for a while and was making himself do it before he lost the momentum. I should have pushed back on the merit order, he said. This morning, when you raised it. Yes, she said. I've been thinking about why I didn't. I know why you didn't. He looked at her. Yeah? Because the last person who formally pushed back on Holt ended up on the night shift doing paperwork until she left. Because the system here has made it structurally costly to be right when someone with more authority is wrong. That's not entirely your failure. It's the failure of the system. But you're also a physician, and the patient was in the bay, and you made a choice. Reyes was quiet. He looked like someone absorbing something they'd needed to hear for longer than just today. What do I do about it? Do better next time. And make sure there are systems in place so the next merit doesn't depend on someone being brave enough to push back individually. She looked at him. That's what the last 6 years of trying to function in this department have cost. The hours I spent navigating around a culture that penalized clinical honesty instead of just doing the clinical work. He nodded slowly. He didn't try to add anything to that. At 4:17 p.m., the situation in the administrative wing reached the threshold of visibility. Emily was aware of it first through the change in ambient behavior, people moving in the corridors with the specific orientation of those who know something is happening and are trying to get a sightline without appearing to. Then Ferris appeared at the ER entrance with wide eyes and the expression of someone who has just witnessed something they're still processing. They're arresting people, he said. She already knew this was coming. She hadn't known the exact timing. Where? Administrative wing. They walked Strike out first, then one of the procurement managers, Aldrich, I think, from supply chain. And now, he stopped. They've got Voss. He came in through the back entrance with 2 federal agents, and now there are 3 more waiting in the administrative lobby, and Dr. Holt is... He paused again, recalibrated. Holt's just standing in the corridor watching. Emily set down what she was doing and walked. She didn't walk fast. She didn't need to. What was happening was going to happen at its own pace, and she wasn't going to the administrative wing to watch or to have a moment or to see the expression on Voss's face. She was walking because she needed to confirm that the parts of this morning she'd set in motion were completing correctly. The way you confirm a repair is holding before you close the chest. The administrative lobby was not large. Blackwood Regional was a regional hospital, a good one, well-regarded, medium-sized. Not a sprawling academic center, and its administrative footprint reflected that. The lobby had a reception desk, a set of chairs along one wall, a corridor leading to the executive offices, and right now it had 4 federal agents, 2 state authority representatives, Lund coordinating from a position near the corridor entrance, and Randall Voss. Voss was in handcuffs. They were in front, not behind, a detail that was probably jurisdictional. And he was wearing the expression of a man who had run every calculation available to him and found that they all led to the same place and hadn't yet reconciled himself to that destination. He saw Emily when she entered the lobby. The expression that moved across his face in that moment was not what she'd expected. She'd expected something defensive or contemptuous, the reflexive downward reassessment of someone who'd spent the morning defining her as a problem solved. What she saw instead was something more complicated. Recognition, and underneath that recognition, the specific look of a person who has understood, all at once and too late, the full cost of a decision they thought was cheap. She didn't say anything to him. She didn't need to. Lund was at her elbow. State Medical Board has been notified. Voss's license is being flagged for emergency suspension pending the investigation outcome. She spoke at low volume, efficiently. Strike has agreed to full cooperation. He's provided additional documentation that we didn't have before, internal meeting notes going back 18 months that name the board members and the supply distributor contact explicitly. The board members, Emily said. What happens to them? They've been contacted. Both are currently speaking with their attorneys. Whether they cooperate or contest will determine the timeline. but the documentation is sufficient that the outcome is not in significant doubt. Lund looked at her. The evidentiary picture that you started building 3 weeks ago with a supply inventory discrepancy and 2 compliance emails is going to be what anchors this entire case. Emily looked at Voss being walked toward the exit by 2 federal agents. She felt not satisfaction exactly, something quieter and less clean than satisfaction. The specific feeling of a thing that has been wrong for a long time finally being corrected, which is not the same as relief because the time it was wrong doesn't disappear. Merritt had spent 4 hours deteriorating in Bay 4. Ora Tatum had received a contraindicated medication. The supply shortages had affected patient care in ways that would take a full audit to map. The nurses and physicians who'd been watching and saying nothing had been shaped by this environment for years. None of that was undone by handcuffs on Randall Voss's wrists. But it was a beginning. It was the specific kind of beginning that starts with accountability. "The phone call I received in the office," Emily said. "The person who told me to walk away from the terminal. We've identified the registered owner of the cell. Agents are at that address now. Is there anyone above Voss in this? Above the board members?" Lund considered the question with the careful precision of someone deciding what they can and can't share. The supply-distributor relationship has connections that extend beyond Blackwood. Whether those connections rise to the level of organized coordination or represent individual decisions made by individuals who happen to share a financial interest, that's something the investigation will determine. She paused. "What I can tell you is that nobody above this building is going to be able to make what's on that extraction unit go away." Emily nodded. Outside, through the lobby's glass doors, she could see a state police vehicle and the 2 federal cars that had brought the agents who were now walking Voss out. The afternoon light was hitting the hospital's front approach road at a low angle, the same approach road the military convoy had turned into that morning. That morning felt like a different day. She turned back toward the ER. There were patients who needed checking. Breck's drain output needed another measurement. Mafi had been moved to a general ward post-op, but was still under military medical oversight, and she wanted to confirm his pain management was calibrated correctly. The 2 remaining stable casualties needed discharge coordination with their unit medical officer. The regular ER census had continued all day underneath everything else, and the afternoon shift was managing it, but she'd been mentally tracking 3 cases from the morning that she wanted to confirm had resolved. She was 20 feet from the ER entrance when Vail fell into step beside her. They walked for a moment without speaking, which was comfortable in the way that silence is comfortable between people who have been in a sustained high-pressure situation together and have established a practical understanding of each other without much ceremony. "Your service record," he said. "The classified portion." She looked at him sideways. "The flag on it. The access that was made 4 days ago. We traced it. It wasn't related to the federal investigation." She kept walking. "Then what was it related to?" "Someone outside the hospital, outside the fraud case." He was quiet for a step or 2. "There's a program. I can't be specific about it here. But there has been an active search for personnel with your specific combination of skills and experience for the past 8 months. Combat trauma, forward deployment, ER clinical practice, specific procedural experience." He glanced at her. "Your name has been on that list for a while. The flag 4 days ago was a status check, whether you were still active, still practicing." She stopped walking. He stopped too. He was watching her with the expression of someone delivering information that he knows is going to require time to process and is not trying to rush past that. "What kind of program?" she said. "The kind that doesn't get described in a hospital corridor." He reached into his jacket and came out with a card. Plain, minimal, a number and a name. The name was not his. The kind where what you did this morning is considered baseline qualification, not exceptional circumstance. She looked at the card. She didn't take it yet. "I have a department to get back to," she said. "I know. That's not a decision for today." He extended the card another inch. "It's a decision for when you're ready." She took the card. She looked at it for a moment, then put it in her scrub pocket and kept walking toward the ER. The rest of the afternoon moved in the particular way that afternoons move after extraordinary mornings. The urgent things resolved one by one, the non-urgent things accumulating in the queue, the people around her recalibrating in real time to a situation that was still changing shape. At 6 p.m., Foy called her to a brief meeting. Foy was competent and visibly stressed, and handling the stressed-competent combination with the controlled focus of someone who understood that the institution needed a functioning face while its structure was being forensically examined in the administrative wing. "Your termination this morning," Foy said. "I've been advised by the hospital's legal representation, the new representation, not the previous firm which has a conflict, that in light of current circumstances, the administrative action against you this morning is being reviewed." Emily looked at her. "Specifically, the documentation supporting the action, the patient complaint, has been identified as fabricated. Combined with the timing relative to your compliance communications," Foy stopped. She looked uncomfortable in the way people look when they're saying something that's both necessary and deeply inadequate, given the scale of what it refers to. "I want to be direct with you. What happened to you this morning was wrong, and it was not an isolated administrative error. We know that now. What I can offer you today is a formal reinstatement, effective immediately, with full back pay for the day." Emily looked at her for a long moment. "1 day of back pay," she said. Foy's expression confirmed that she understood exactly how insufficient that sounded, relative to 6 years of working inside a system that had been organized around protecting the people who had done this. "It's what I can authorize today. The broader question of what the institution owes you, in terms of remediation, in terms of what your compliance disclosures led to, that's part of a process that's going to take longer to work through." "I know," Emily said. "I'm not asking for everything today. I'm noting that 1 day of back pay doesn't reflect the actual stakes of what I'm standing in the middle of." "It doesn't," Foy agreed. "You're right. And I'm going to be honest. I don't know exactly what the institution looks like on the other side of what's happening in the administrative wing right now. But I know we need people in this building who do what you do, and I know that if you're willing to be here, I need you here." She paused. "The ER needs you here." Emily thought about the alternative, the parking lot, the drive home, the specific silence of an apartment that she'd been too tired to spend real time in for the past 6 years, because she was always at Blackwood, always covering, always the one who stayed. She thought about the card in her scrub pocket. "Reinstated," she said. "Today. And we revisit the rest of it when there's a structure in place to revisit it with." "Yes," Foy said. "And Dale Merritt's care this morning gets a formal incident review, not to assign blame, to understand the system failure that let it get that far." Foy's expression said that this was harder, but not unreasonable. "I'll initiate it. Then I'm back on the floor." She left the meeting and returned to the ER, where the evening census was building and the afternoon shift was getting stretched, and 3 things needed her attention immediately. And the day continued in the way that days continue when you've been through something that hasn't finished having consequences yet. At 7:42 p.m., the final federal vehicle left the hospital's administrative approach road. She was checking Breck's overnight vitals instructions with So when the news came through. Not formally, not through official channels, but through Ferris, who had apparently been monitoring the situation at the administrative lobby with the dedication of someone with no other commitments and considerable curiosity. "They're gone," he said. "All of them. Voss, Strike, Aldrich, and there are state seals on the procurement office and the compliance office." "Okay," she said. "That's it? Just okay?" She looked at him. He was young, 24, maybe 25, and he was looking at her with the expression of someone who expected a significant moment to feel more significant from the outside. "What did you expect?" she said. "I don't know. Something more?" "This is what more looks like," she said. "It's not a scene. It's paperwork and sealed offices and people being walked out in handcuffs, and then the building still has patients in it, and those patients still need care." She looked back at Breck's vitals sheet. "The more comes later. The more is the audit results, and the remediation payments, and the license suspensions, and the testimony, and the patients who were affected having someone acknowledge that they were affected. That part takes months." Ferris considered this. "Does it feel like enough?" She thought about the question honestly. "Ask me in 6 months," she said. He nodded like he was filing that somewhere useful. She finished the vitals instructions, confirmed the overnight coverage with So, and was heading to check the last item on her mental list, a pediatric case that had come in at 4 and that she'd been tracking at a distance all afternoon, when the ER's main entrance opened and a woman walked in. She was in her 50s, professionally dressed, carrying a bag that suggested she'd come from somewhere formal and diverted here. She had the bearing of someone accustomed to institutional environments and the specific tightness around the eyes of someone who has been making difficult decisions for most of the day. She looked around the ER until she found who she was looking for. She was looking for Emily. Emily went to her. The woman said, "My name is Director Salter, State Health Authority. I've been in contact with the federal investigation team this afternoon." She looked at Emily steadily. "I've been briefed on the events of today, including your clinical work with the military casualties and the supply discrepancy documentation you originated. I want to ask you some questions if you have time." "About the investigation?" Emily said. "Partly." Salter paused. "Also about the hospital, where it goes from here, what it needs to function correctly." She glanced around the ER, the evening census building, the staff moving through their work, the specific organized energy of a department that had absorbed an extraordinary day and was still functioning. "You've been inside this institution for 6 years. You understand its failures in a way that a federal audit won't by itself capture." Emily looked at her. Salter looked back, direct, without performing neutrality, with the expression of someone who was genuinely asking and prepared to hear a genuinely complicated answer. "That's a long conversation," Emily said. "I have time," Salter said. "If you do." Emily was about to respond when her pager went off. She looked at the display. Bay 3. The pediatric case she'd been tracking. She looked at Salter. "Give me 10 minutes." "I'll be here," Salter said. Emily moved toward Bay 3, reading the alert as she walked. The pediatric patient's oxygen saturation had dropped. The attending was requesting a second assessment, and the preliminary read from the monitor suggested something that the attending's original diagnosis hadn't fully accounted for. She pushed through the bay curtain. The child, 8 years old, she remembered from the earlier chart check, admitted for what had been coded as respiratory infection, was sitting up in the bed in the specific posture of a child working harder than they should have to for each breath. The attending, a young physician named Osei, who had been on the floor since noon and was clearly running on the back half of his energy reserves, had a stethoscope on the child's back and an expression of concentrated concern. He looked up when Emily entered. "The O2 has been dropping for the last 20 minutes, he said. "I'm not confident in the presentation. It's not tracking with the initial diagnosis." She listened to the child's breath sounds. She asked the child 2 questions and got one answer and one shrug that was itself informative. She looked at the monitor waveform. She looked at Osei. "When did you last get a chest x-ray?" "On admission, 3 hours ago." "We need a repeat. Now." She looked at the waveform again. "And I want bilateral breath sounds documented in the last 15 minutes, not the last 3 hours." Osei was already moving. He had the specific quality of a young physician who was not too proud to be redirected quickly when the clinical picture was changing, which was a quality she'd learned to recognize and value because it was less common than it should have been. While he ordered the repeat imaging, Emily stayed with the child. The child's name was Theo. He was watching her with the steady assessment that children deploy when they're frightened and are trying to determine whether the adult in front of them is someone who knows what they're doing. "Hey, Theo," she said, "I need you to take a breath for me, as deep as you can." He tried. The effort was visible, and the result was less than it should have been. She put her hand on his back. She felt the chest mechanics. She made a clinical assessment that she did not verbalize in the bay because Theo was 8 years old and listening, and some things are communicated between medical personnel first. Osei came back. She leaned close and said 3 sentences to him. His face changed. "Are you sure?" he said. "No," she said, "but I want the x-ray to confirm before we wait any longer." The x-ray confirmed it in 11 minutes. It was a pneumothorax. Left-sided, moderate, the kind that can develop insidiously in a child presenting with what looks like a respiratory infection, especially if the initial imaging was taken at an angle that made the presentation ambiguous. It was not yet tension, it was heading there. She had Osei call the attending pediatric surgeon. She had the team prep for needle decompression as a bridge. She talked to Theo's mother, who had been in the waiting area, and was now in the doorway of the bay with her hands clasped and her face carrying the particular expression of a parent who is trying to stay outside the radius of the medical activity so as not to interfere and who needs someone to tell her directly what is happening. Emily crossed to her. She said what needed to be said. She said it clearly and without softening it into ambiguity, and also without adding terror that wasn't warranted, which was a specific balance that required a kind of attention that she'd learned to give not in training, but in the field, in the years of communicating with families under circumstances where words were the only thing she had control over. The mother's name was Joanna. She pressed her lips together and nodded and said, "Will you be there?" "Yes," Emily said. Joanna looked at her for a moment. "Thank you," she said, and the thank you carried more than the current situation. It carried the hours she'd spent in the waiting area and the sense that someone in this building was actually attending to her son. Emily went back to Theo. The pediatric surgeon arrived. The procedure went as procedures go when caught at the right time. Not smoothly, not dramatically, but correctly, step by step, with the incremental improvement in monitoring that signals a clinical problem being addressed rather than worsening. Theo's oxygen came up. His breathing eased. By the end of it, he was looking at the ceiling with the expression of a child who has been through something and is very tired, and is also, unmistakably, better. "Good job," Emily told him. He looked at her sideways. "I didn't do anything." "You breathed, all day, with a collapsed lung. That's something." He considered this with the gravity of an 8-year-old doing genuine philosophical work. "Okay," he said. She left him with his mother and the surgeon and walked back to the main ER floor. Director Salter was sitting in the chair beside the nursing station. She had a legal pad and was reviewing notes, and she looked up when Emily returned with the specific alertness of someone who has been waiting without impatience. "Ready?" Salter said. "Yes," Emily said. "Let's talk about this hospital." They sat. Salter opened her legal pad. Emily looked at the ER, the evening shift in full motion, the census board full, the staff moving with the particular focused efficiency of people doing difficult work in difficult circumstances because the work needed doing, and began to talk. She started with the supply discrepancies and the compliance channel that had routed her emails directly to the man committing the fraud. She moved to the culture in the emergency department, the informal penalization of clinical disagreement, the mechanisms by which a physician's authority had been allowed to function without meaningful check. She talked about merit and oritatum, and the medication flag, and the chart documentation that went nowhere. She talked about Bryce going quiet, and Quan studying her shoes, and Reyes looking at the wall. She talked about 6 years of catching things and documenting things and raising things and feeling the specific grinding weight of an institution that had learned to absorb concern without acting on it, that had built a muscle for making problems disappear rather than fixing them. Salter wrote. She asked clarifying questions. She didn't offer reassurance, and she didn't perform sympathy. She listened in the way that people listen when they intend to use what they're hearing, and Emily found that she was more comfortable with that than she would have been with softness. They talked for an hour and 20 minutes. At the end of it, Salter closed her legal pad and looked at Emily directly. "I'm going to be straightforward with you," she said. "When Blackwood comes back from this, and it will come back because the region needs it to, it's going to need to be rebuilt, not cosmetically, structurally. The oversight mechanisms, the reporting channels, the accountability architecture for clinical decision-making." She paused. "That requires someone who understands where it failed, not a consultant from outside who reads the audit results. Someone who is inside the failure and can see the difference between what the org chart says and what actually happens." Emily looked at her. "That's a different conversation than the one I thought we were having." "Yes," Salter said. "It is." Outside, the night had settled over Ashcroft and the parking structure where Voss had sat in his car, making calls that became evidence. The federal vehicles were gone. The military convoy was still in the approach road. The casualties weren't ready to transfer yet, and Vile had confirmed they'd hold position through the night. Inside, a regional hospital was running on its evening shift, understaffed in the way it had always been understaffed. covering the gap in the way that nurses and junior physicians covered gaps, by doing more than the chart said was their job and not writing it down anywhere. Emily looked at Salter's legal pad, closed on the table between them. She thought about the card in her scrub pocket. She thought about what Salter had not quite said yet, but was clearly about to say. And she thought about whether the thing she wanted, the thing that was under all of today, under all 6 years, was the title or the actual work, and whether those two things were going to turn out to be the same. "Before you make an offer," she said, "I need to know one thing." Salter waited. "The oversight mechanisms you want to rebuild, the reporting structures, the accountability architecture." Emily looked at her steadily. "Are those changes actually going to happen, or are you asking me to be the person who documents the gap between what gets promised and what gets implemented?" Salter was quiet for a moment. It was not the quiet of someone who hadn't anticipated the question. It was the quiet of someone deciding how honest to be. "Both," she said finally. "Honestly, the structures will be built. Whether they hold depends on whether the people inside the institution choose to use them. That's never guaranteed." Emily nodded slowly. That was the most honest answer she'd gotten from anyone in an administrative role in 6 years at this hospital, and she didn't know yet what she was going to do with it, but she recognized it for what it was. Her pager went off again. She looked at the display and stood up in the same motion. "I have to go," she said. "I know," Salter said. "Think about it." Emily was already moving when the charge nurse called her name from the ER entrance. Urgent, not panicked, the tone that meant something had arrived that needed immediate attention. And she came through the door to find a paramedic team wheeling in a gurney with a patient who was conscious and talking, and whose left arm, below a field tourniquet applied with clear experience by someone who knew what they were doing, was in a condition that made the paramedic leading the team say, the moment Emily made eye contact, "MVA, high speed, brachial involvement, distal pulse is thready. We need Petrov, or we need someone who can keep him stable until Petrov gets here." Emily looked at the patient, mid-30s, awake, the specific gray pallor of someone bleeding somewhere that they haven't fully registered yet, and said, "What's your name?" "Reyes," the man said, and then caught his own expression of confused, almost recognition at his own name, and said, "No, it's Navarro, Marcus Navarro, sorry. I'm a little—" "It's okay," she said. She was already at the arm, already checking the pulse point, already talking to the paramedic about the tourniquet time and the transit pressure and what they'd given him in the field. "I've got you, Mr. Navarro. We're going to take care of this." She said it the way she'd said it to Breck that morning, not as reassurance, as fact. And behind her at the nursing station, a printed email was sitting in the incoming tray, faxed from the State Health Authority's Documentation Division, time-stamped 4 minutes ago, bearing the official header of the State Medical Review Board, and below the header, 2 names. The first was Randall Voss. The second name on the emergency suspension list was not a name she'd expected, and the charge nurse who had printed it hadn't read it carefully yet, and Emily was 20 feet away managing Marcus Navarro's brachial artery, and no one in the ER knew yet what the second name on that list meant for the morning that was already coming. The charge nurse's name was Delphine, and she had been at Blackwood Regional for 11 years, which meant she had seen things come and go in the way that only people with a decade of institutional memory truly see. Not as events, but as patterns, not as surprises, but as variations on a theme she already knew. She picked up the faxed document from the incoming tray at 8:43 p.m. because it was sitting there, and she was at the station, and it was her job to process incoming documentation. She read the header, she read the first name, she read the second name. She stood very still for a moment. Then she walked to the entrance of Bay 1, where Emily was stabilizing Marcus Navarro's brachial artery with the focused precision of someone who has been doing difficult things all day and has not yet found the bottom of her capacity for doing them. And she waited until Emily had Navarro's arm stabilized and had spoken to the vascular consult on the phone and had handed the immediate management to the attending with clear instructions before she said, quietly, "Emily, there's something you need to see." Emily looked at her face. She could read Delphine's face the way you read the faces of people you've worked beside for years. The specific language of suppressed urgency, the signal that this was not a chart question or a scheduling issue. She crossed to the station. She read the document. The second name on the State Medical Review Board's emergency suspension list was Marcus Holt. She stood with the paper in her hand and processed what that meant. Not the institutional mechanics, those were clear enough. The board had moved faster than she'd expected, probably on the basis of the merit documentation and the pattern evidence that Strike's cooperation had provided, which apparently included records of internal complaints about Holt's department that had been received, logged, and quietly shelved by the compliance office over the past 3 years. 3 years. Not complaints about fraud, not about billing. Complaints about clinical culture, about the cost of disagreement, about patients. She thought about what it meant that it had taken a federal fraud investigation to surface the pattern that nurses and junior physicians had been living inside for years, and she felt the specific weight of that. Not anger, not vindication, just the heavy factual grief of a system that had been capable of seeing and had chosen not to. She set the paper down. "Does he know?" she said. "Not yet," Delphine said. "He left the building about 40 minutes ago." "Okay." She looked at the document one more time. "Make sure it gets to Foy tonight, and to the attorney the hospital has on call." "Already on it," Delphine said. Emily went back to the ward. Marcus Navarro went to surgery at 9:15. Petrov took the case, and the brachial repair was clean. Not simple, but clean. The kind of procedure that holds when done correctly and had been set up correctly by the field tourniquet and Emily's stabilization in the bay. Navarro was going to keep the arm. He was going to have a significant recovery ahead of him and would probably have questions about nerve function for months, but he was going to keep the arm. Petrov told her this himself, stopping at the nursing station on his way out of the OR. "Good assessment on the vascular status," he said. He said it the same way he'd said it about Mafi, simply, without ornamentation. Coming from Petrov, it was the equivalent of a lengthy endorsement. "Thank you," she said. He paused. He looked like a man about to say something that was slightly outside his normal register. "What you did today, with the military cases, I've been in this building for 14 years. I haven't seen anything like that." She looked at him. "The second closure on Breck was field technique. It's not textbook." "I know it's not textbook." He said it without criticism. "I'm not saying it should be. I'm saying it worked." He left. She sat at the nursing station for a moment. Just a moment. The ward didn't offer more than that. But she sat, and she let the day exist for a second in its entirety, which she hadn't done yet because there hadn't been room to. It was a lot. It was not neat. Navarro was going to wake up tomorrow and do the hard work of recovering. Theo was going to need monitoring through the night. Breck was stable, but not out of the woods. Not really. Not with 2 surgeries in 12 hours. The next 72 were going to tell the fuller story. Mafi's limb had been saved, but the nerve damage picture wasn't complete yet. Merritt was in post-op and would recover, and that was real. But the 4 hours of deterioration while the wrong decision stood was also real. And both things existed simultaneously in the same record. And the hospital, the institution that she'd spent 6 years inside, that had walked her out its front door at 8 in the morning, and was now, at 9:20 p.m., operating under a records hold with its director in federal custody and its chief of emergency medicine under a license suspension and its compliance officer cooperating with investigators. The hospital was still running. Because hospitals don't stop. The census board didn't care about any of this. The patients in the bays didn't know. The work continued because it always continued, and the people doing it were the same people who'd been doing it before the federal vehicles arrived, trying to do it as well as they could under the circumstances they had. That was the thing about institutions. The corruption at the top was real, and its consequences were real, and the people who'd enabled it deserved what was coming to them. But the institution itself was made of thousands of individual acts by people trying to do their jobs, and most of those people had been doing their jobs as well as the environment allowed. The environment had failed them as much as they had failed each other. Changing the environment was the work. The rest, the arrests, the suspensions, the federal investigation, that was consequence. Necessary. Not sufficient. She understood that more clearly tonight than she had at any point in the 6 years she'd been inside this building, and she didn't know yet whether that understanding was the beginning of something or the closing of something. and she was too tired to decide. Vile found her at 10 p.m. He'd been in and out of the building throughout the evening, coordinating the overnight disposition of the military casualties, and he had the look of a man who had also been through a long day and was not complaining about it. Breck's transfer is set for 0600 tomorrow, he said. Military medical facility. He'll get the post-op care he needs there. Good. Mafi's cleared for transfer tomorrow as well, pending morning assessment. He paused. He asked about you this afternoon. Wanted to know if you were still in the building. What did you tell him? I told him yes. He looked at her steadily. The card I gave you. Yes. No pressure on timing, but the window doesn't stay open indefinitely. She looked at him. She thought about Kirkland and the forward aid stations, and the specific clarity of purpose that came with field medical work that was different from the clarity of purpose in an ER. Not better or worse, just different. The difference between a fixed point and a moving one. I'll be in touch, she said. He nodded once. That was all he needed. He was nearly at the exit when he stopped and turned back. For what it's worth, he said, Metzger was right. You were the best he'd had. She didn't respond to that. But she didn't look away either, and after a moment he left and she sat with the weight of it for a few seconds before the pager brought her back. 3 weeks later, Blackwood Regional held a formal proceeding. It was not called a ceremony. The state health authority was careful about that language. It was a structured notification event, which was the bureaucratic way of saying that a number of official things needed to be communicated to a number of people in the same room at the same time, and the most efficient way to do that was to put everyone in the same room. The result looked, from the outside, enough like a ceremony that most of the staff treated it as one. The atrium of Blackwood Regional had been used for two things in the 11 years Emily had been aware of it: blood drives and the annual administrator's address, both of which had the specific energy of institutional obligation. Today, it had a different energy. It was full: nurses, physicians, administrative staff, maintenance workers, people from departments that rarely overlapped in daily operations. And it had the particular feeling of a room where people are present not because they're required to be, but because they need to witness something. Director Salter stood at the front. Randall Voss had, 1 week prior, been formally charged with federal health care fraud, obstruction of justice, and conspiracy. He had surrendered his medical license without contest, which his attorney had recommended on the grounds that contesting it would not improve his position and would add to the documentary record against him. He was awaiting trial. The two board members had reached cooperation agreements with the federal investigation, which had significantly expanded the scope of the procurement fraud documentation and implicated the supply distribution company in a pattern of institutional fraud that extended to 2 other regional hospitals in the state. Strike had received a reduced charge in exchange for his continued cooperation. He had not kept his job. He had kept his freedom, which was the deal he'd made. The supply coordinator, Bryce, had been interviewed 3 times by federal investigators. She had not been charged. She had resigned. Marcus Holt's license suspension had been converted, after a full state medical review board hearing, to a formal probationary status with mandatory supervision and clinical monitoring for a period of 18 months. It was not the most severe outcome the board could have delivered. It was not a slap on the wrist. What it was the specific calibrated consequence for a physician whose clinical judgment under supervision was sound, but whose conduct as a department authority figure had created documented patient safety failures. He would not be running a department for the foreseeable future. He would be practicing medicine with someone watching. He had not objected. He had attended the board hearing, answered every question, and said at the conclusion of it, "The nurse who flagged the merit case was right. I was wrong. I should have listened 6 years ago when the pattern started, and I didn't. And that is something I'm going to have to account for the rest of my career." The board chair had written those words into the hearing record. Emily had read them later, in the official summary. She hadn't known he was going to say that, and it had landed in a place she wasn't entirely prepared for, which was the specific place where accountability and inadequacy existed simultaneously, where someone doing the right thing finally was real, and where the years it had taken to get there were also real, and neither canceled the other out. Kwan had kept her job. The email she'd preserved, Voss's instruction to fabricate the patient complaint, had been the anchor document for the retaliation element of the federal case. Her cooperation had been noted formally in the investigation record. She had been moved to a restructured compliance department, one that now reported to an external oversight committee rather than to the executive director. Ora Tatum had been contacted by the patient care review team. Her medical records had been reviewed. The medication combination she'd received had been flagged for outcome monitoring, and a remediation process had been initiated. She was, when Emily had asked Lund about her 2 weeks ago, doing well. Salter's voice in the atrium was clear and unhurried. She spoke about institutional accountability and the mechanisms of oversight and the specific ways in which the compliance failures at Blackwood had been systemic rather than individual. Not to diminish individual responsibility, she said carefully, but to insist that individual responsibility existed within systems and that fixing systems required more than replacing individuals. She said, "What one person inside this institution did 3 weeks ago was find the edge of something wrong and refuse to let it disappear. She didn't do it because she had power. She did it because she had a standard, and the standard mattered to her more than the comfort of pretending not to see." The atrium was quiet. "That is the kind of institution Blackwood Regional is going to become," Salter said. "Not a place where one person carries the standard alone. A place where the standard is built into every channel, every reporting mechanism, every accountability structure, so that no single person ever again has to carry it at the cost of their career." She looked at Emily, who was standing near the back of the atrium, because she'd arrived late from a patient handoff and had taken the closest available position to the door. "Emily Carter," Salter said, "effective today, by formal authorization of the State Health Authority and the reconstituted Board of Blackwood Regional Hospital, you are appointed Director of Emergency Trauma Services, with a mandate that includes the review and redesign of clinical oversight protocols across the emergency department." The room didn't explode. It wasn't a movie. People clapped, the genuine kind, not the performed kind. And Delphine, who was standing 4 people to Emily's left, made a sound that was somewhere between a laugh and something else. Emily stood in the back of the room and felt the weight of the title settle onto the day's already considerable weight and thought, this is not the end of anything. This is the beginning of a different kind of difficult. She was right about that, and she knew it. And she accepted it in the way you accept difficult things that are also true and right. Not with joy exactly, but with the specific purposeful settling of someone who has found the work that fits the shape of what they're capable of. Afterward, in the corridor outside the atrium, Vielle was waiting. She hadn't expected him. She'd thought the military contingent had concluded its business at Blackwood the night the last casualty was transferred. He was in service dress. He had the card she'd given back to him 2 days ago. She'd returned it, not as a refusal, but with a note that said, "Not yet," and he extended it again. "Breck's out of the military facility," he said. "He'll be in physical therapy for 4 months. His prognosis is for full. Return to duty." He paused. "He asked me to give you this." He handed her a folded piece of paper. She opened it. It was a handwritten note. The handwriting was careful, the kind of careful of someone who doesn't write by hand often and is making the effort. It said, "I've had good medics. I know the difference between good and exceptional. Thank you for what you did." Mafi says the same. Breck below. That, in different handwriting. Looser, younger, "My arm works. That's you." Mafi. She folded it again. She wasn't going to be sentimental about it in a corridor with Vielle watching. But she also wasn't going to pretend the note didn't mean something, because it did, and she was tired of pretending things didn't mean what they meant. "Tell them both I'm glad," she said. "I will." He looked at her. The card. "I know." She looked at it in his hand. "I'm not ready to leave this place yet. There's work to do here that I started and I'm going to finish." "I understand that. But I'm not saying no. I'm saying not yet." He nodded once. He pocketed the card. "When you're ready." He left. She stood in the corridor for a moment. The atrium behind her was dispersing. She could hear the shift in ambient sound, the conversation starting up, the movement of people back to their departments and their work. In 30 minutes, she had a meeting with Foy and the incoming oversight committee to begin the clinical protocol review. In 2 hours, she had a second meeting with the federal investigation team about the timeline of supply discrepancy documentation. In between those meetings, she had a department to run. She thought about the things she'd said to Ferris, that more looks like paperwork and sealed offices and process, and that the real more comes later and takes months. She'd been right about that. She was going to be living in the real more for a long time, and it was going to be slower and more unglamorous and more exhausting than anything that had happened on the day the convoy arrived. She thought about Bryce, who had gone quiet rather than see. She didn't hate her for it. She understood it. The institution had created the conditions in which not seeing was the rational survival choice, and Bryce had made the rational survival choice, and 23 other people in this building had made the same one. Understanding why people chose silence didn't make silence the right choice, but it did make the work of building systems where speaking was survivable more urgent and more specific than simply telling people to be braver. She thought about the morning, that specific morning, 3 weeks ago, when Porto had her right arm and the second security guard had her left, and the automatic doors slid open and the military convoy appeared. She hadn't known what was coming. She'd known she was right about the billing records. She'd known she was right about merit. She'd known the system she was inside was broken in ways that went deeper than any individual decision. She hadn't known any of it was about to break open. She thought she was walking out to a parking lot and a phone call to the state medical board, and the long grinding work of trying to get someone outside the institution to hear what the institution didn't want heard. Instead, she'd gotten 6 armored vehicles and a special operations commander, and one of the most compressed and consequential days of her professional life. Life was not a controlled experiment. You didn't get to choose the mechanism of your vindication. You only got to choose whether you kept your standard when it cost you something. She had kept it. It had cost her. The cost was real, and the vindication was real, and neither fact made the other smaller. She looked at the corridor. At the ER entrance at the far end, where the evening census was already building and someone was calling her name. Not her title, not yet, just her name, the way people called it when there was work that needed doing. She walked toward it, not because she'd been recognized, not because the title made her more capable than she'd been yesterday or than she'd been 3 weeks ago when they walked her out the door. She walked toward it because the work was there and she was the person to do it, and that had always been true. And the only thing that had changed was that the institution finally had the architecture to acknowledge it. That was the thing she would carry from this, not the commendation, not the appointment, not the federal case or the arrests or the conversation with Vael. The thing she would carry was simpler and harder than any of that. The understanding that the gap between what you know is right and what the people around you are willing to recognize is not your problem to solve by becoming smaller. It is your problem to solve by staying exactly as large as the work requires, for exactly as long as it takes, even when the cost is everything you currently have. She pushed through the ER doors. Delphine looked up from the nursing station. Trauma incoming, ETA 4 minutes. What do we have? Multi-vehicle, 3 casualties, 1 critical, 2 stable. Emily went to the supply wall and pulled gloves. Then let's go. The doors opened. The work arrived. And Emily Carter, combat medic, ER nurse, the woman they had tried to erase and couldn't, was already there, already ready, already exactly where she had always intended to be.